if you look in the right direction, you can see the bulk of the Guam Regional Medical City. I literally ran by the place on Sunday morning, and pleased with the progress that they have been able to make on that facility so far. Love the lighting grid on the outside. Looks like stars up and down the sides of the building. And the color scheme was working, and it was nice to see, even as early as I was out there running, a bunch of people that were moving towards, as I said, being able to hand Margaret Bengzon, the CEO, the set of keys to the front door so we can open Guam Regional Medical City. She's in town, and she joins me now on News Talk K57. Very nice to hear from you again, Margaret Bengzon.
Hi, likewise. Good to see you here, Gray.
I think the last time we got together was kind of an update session that you had over at the Hilton just a couple of months after the groundbreaking, and as I said,
that's right.
It's a delight to see where the construction has gone so far.
I know. It's really going, and it's really going well. As you know, it's kind of been a long and a little bit of bumpy road, but you know we've secured a partial occupancy permit, and we're working very closely with the fire marshals and DPW, so our staff can begin occupying the building in the next few days. And we want to finish, installing the equipment, and we want to begin familiarizing ourselves with the building and begin working and training on site. And we're still directed at April to May first patient date. So it's going quite well. Okay, there are a couple of things that need to happen between here and there, and there was a lot of conversation. And thanks for inviting the media out to take a look at your rebar couplers. Unless you are intimate with the construction industry, I had no idea that such a thing even existed. Well, like I said, one of the bumps along the road, but sort of the glass half full story to that is, if it was a problem, it's good we discovered it now, before we were in the building and taking care of patients. So DCK has been very good on its commitments to get the building fixed and get us a good quality hospital, and then we're on our way. One of the things that has occurred to me, and you and I have some similar friends around here, is some of the conversation. The original designs of the hospital had certain capabilities in mind, but the longer that you have spent on the ground here and looking at what the needs are in the community, some of those have changed, and you have added to the capabilities, and that has required some redesign and another look at blueprints. Is that not correct? That's absolutely right. So, for example, at the beginning, we weren't contemplating setting up an interventional cardiology cardiac cath lab from the very beginning. But as we got an appreciation of what the island needs, it became apparent that we needed to set up these facilities, and these are very complex facilities to set up. So we're setting up a hybrid OR and a digital OR and a really state-of-the-art cath lab to take care of the hearts of our people in Guam. And setting up the linear accelerator for our cancer center was also very, very important but very complicated work. And we've also decided in the last few months to set up a hyperbaric chamber for wound care and diabetic care for our patients. So these are very much needed services, but very complicated to set up. I was going to say, how do your guys over at the construction company, how did they react when you come in and say, hey, we bought another piece of gear, and it's going to require thicker walls, and it's going to require steel plating and that kind of thing? Well, it's about working together as a team, and it's about planning, and it's about organizing ourselves to get the work done, and that's how it's been. You talk about putting together the staffing, and it seems to me within the last month or so I'd seen some advertisements go out for a variety of positions at GRMC, and a whole lot of nursing positions that you're going to be looking for out there. How is the staffing, how's the headhunting coming along? Right. Well, we're upwards of 380 people now, and we're looking to bring in another about 100 in the next 2 months or so. But I think more important than the quantity of the folks is really the quality of the folks. We've been really able to assemble pretty much a dream team for Guam, for the Guam Regional Medical City. And if you look, for example, at our head of clinical services, he's a very seasoned nurse leader who's headed hospitals in the mainland, and as part of the Joint Commission has surveyed close to over 1,000 hospitals all over the world. So he's very well situated as part of the team. Our physician pool is incredible. We don't have just specialists, but we have subspecialists in precisely the areas Guam needs. So we have a cardiologist, we have a neurologist, we have an oncologist, We have a urologist, we have an orthopedic surgeon, we have a neonatologist, and coming soon we're going to have a neurosurgeon, a cardiovascular surgeon, an interventional cardiologist, radiation oncologist, so really superstars in a dream team, and all here because they believe in the dream of the Guam Regional Medical City, which is better healthcare for Guam. And many of them came in, even taking pay cuts, to be honest, but they're here and they're committed, and we're all working well together, and we're working well with the community to get the dream going.
There's a couple of positions that you identified there. I'm not sure that they have a whole lot of that expertise even in the Philippines. You're bringing in some folks that will bring capabilities perhaps that aren't available even at the medical city in Manila.
Actually, no. All these specialties are available in the Philippines.
They are, okay. You were talking about radiation oncologists. I didn't realize that you had that capability there. Okay.
Absolutely.
All right. So there's still the patient then will still have the choices of being able to say, or maybe beginning treatment at Guam Regional Medical City, and then perhaps moving over to Medical City in the Philippines if their treatment requires it.
But only if necessary. The idea is, we want health care to be accessible, quality healthcare in Guam, so to the extent that they can be serviced at the hospital, that's what we're going to do.
So 380 people on the staff now, and you pass by the place. I don't know that I'd be able to find them in there. Where do you have everybody right now?
Well, we have 3 sites actually. We have a original small clinic space at St. Anthony's, and then we have a space in Oka where our IT people are sitting and working very hard to get our electronic medical record system on board. And then we have this huge warehouse by Agana that sits most of the folks. And we're kind of all over the place.
Now, there's training going on certain pieces of equipment and certain procedures now, right?
Absolutely. Okay. And more of that will happen as we're able to set up the equipment in the hospital and bring people in.
There might be somebody listening going, I'd like a job at Guam Regional Medical City. I don't have any medical expertise or anything, but I imagine that there are other positions that you'll be hiring for. Will there be a casting call at some point in the future for some of these allied positions?
For sure. There's all the positions are posted on the site, so the easiest thing to do is get on our website and get the application information there.
Okay. You would also and I love the conversation with you. I know you think twice as fast as I can. I can talk, so it's fun. But you had also talked about all the different places where your staff is at right now. You are currently seeing patients, are you not?
We are at the Harmon Clinic. So we have a specialty clinic there. So our doctors. So while the hospital isn't available for occupancy yet, we've set up our specialist doctors who are on island to begin to see patients and begin to take care of patients. And so they began that about a month ago, and they want to continue to do that, and they will continue to do that.
They're also involved in certain outreach. I got an invitation to walk them all.
Oh, absolutely. So even now, even before the hospital opens, it's very important that we engage the community. We're about patient partnership, and we're about patient education, and we're about patient information. So engaging the community in all these public health activities is a key strategy for us. And the latest one has been an engagement with public works, public health in providing flu shots to the community. And next week we're going to be engaging our cardiologist to walk in the mall as a way to promote health and promote exercise. And so she's going to be doing that, and everybody's invited to join her.
There's T-shirts, so I imagine that there are going to be a number of people that will show up, if for no other reason, just to get kind of a first edition on this.
That's right.
You finally, and I said finally, that I know it's not your word, but I said finally, got the qualifying certificate all signed off. I know that there were a lot of questions flying around back and forth, and some consternation from among people around here. I was one of them that thought that you'd already been made the deal, and I didn't see why it had to take so long. But understanding now that we're past that veil of tears, Margaret, with the QC signed, does that get you faster to stage 2 in your spreadsheets?
Does that get us faster to stage 2? I guess the main thing is it was really a distraction. I mean, having to work through, getting it passed and getting it done and getting it over with. And for me, now that distraction is over, I can really focus on, getting the hospital open and getting it running and delivering the best care we can for the people of Guam.
I understand. But as I said, when with the advantages of a qualifying certificate, then it frees up capital, frees up resources for further growth down the road. And I know that you didn't come here just to build that. So as I said, what are some of the things perhaps in stage 2, if it's not too early to start talking about? What can we look forward to?
Well, actually, the site is situated for another whole wing, another 100 or so beds that we can accommodate there, and we're looking to build that as we fill up the main building. Additional services, there's always need for additional services. Medical technology and health is always developing. So as developments occur, we will be looking to adopt those smartly and rationally, and then again to make it available to the people of Guam.
I'd like to figure out a way to make my millions in the shadow of Guam Regional Medical City. Right now, you have no neighbors up there. It's just a whole lot of jungle in all directions around Guam Regional Medical City. What would you like to see in terms of allied industries or allied businesses opening up around you, either for the convenience of your staff and the facility or your patients?
Well, actually, there's already quite a lot of talk with our neighbors about setting up, for example, a medical arts tower for doctors to hold clinics in. Allied services, medical supplies, housing, for example, for some of the patients that are going to come in from the outer islands. These are all related businesses that will surely do very well situated next to the hospital. Just
based on that proximity, I know that there's a couple of other businesses that have eyeballed some space around there that, again, would like to take advantage of a magnet business like a thriving hospital in that part of the community. And I know that you've gotten a lot of support from members of the community, including your mayor, Melissa Savares.
Absolutely. She's been wonderful from the very beginning. She bought into the dream of the hospital, and she's been supportive all the way.
And partners, other folks that we work with together. Your relationship with the insurance companies, are you pleased with that?
Absolutely. We're beginning to engage them now because obviously we need to get contracts with them out so that their patients can be seen by our hospital, and then the process is ongoing at the moment. Okay,
and then there's how well are you working with Joe Verga and James Gillen over at between the hospital and public health? My conversations with Joe Verga indicated that he enjoys working with you and loves exploring the possibilities of being a 2-hospital town.
Oh, absolutely. We've actually formalized the structure amongst the Navy and GMH and ourselves. So we're organizing monthly meetings where we're really planning out, these are the areas that we can collaborate in, and this is how we're going to make it happen. So we've actually put some structure to that approach, and we're very excited about moving that effort forward.
Margaret, it's always a pleasure talking with you. Don't mind, I've got a doctor. He's not an MD though, but a doctor would like to have a conversation with you for a moment about Guam Regional Medical Cities. If you don't mind, I'd like to conference the call with my friend Dr. Juan Rapadas, who's down around the St. Anthony area where your clinic and one of your shops is. Good morning, Dr. Juan.
Hi, good morning, Ray. I was looking over the website she was mentioning. Lots of positions available. Just wondering if there was any plans to open up some type of behavioral health wing, working with clinical health psychologists, because the nexus between the body and mind, the research in the last 30, 40 years, psychoneuroimmunology, etc., is so close to the health, and the body and the mind is so connected. So I was just wondering if there's any plans to have any behavioral health positions.
Margaret?
Yes.
Anything along those lines, behavioral health?
Yes. For the current site, we don't have provisions for that, but it's clearly a huge need for Guam. And like I said, we have sufficient land space to think about developing additional services such as those in the coming months and years.
Oh, that'd be great, because especially the research for diabetes, being able to utilize therapists and counselors and psychologists, testing and all that would be actually a very good addition to the wing.
Absolutely.
Okay, thanks.
Juan, I appreciate the telephone call. I appreciate the tenor of the question. I think it's interesting, and as we explore Guam Regional Medical City coming online, April-May time frame, and in that scenario, all of the different things that we might be able to ask about. What else can we do around there, and what are some of the things that we really need in this community? Although I must say, you're a business person, you're CEO first. It seems to me that while providing the care is a wonderful thing, getting paid to provide the care is also important as well. What mechanisms are you going to be putting in place to make sure that you're adequately compensated for the care that you provide, and you don't work yourself into the same place, sadly, that Guam Memorial Hospital is, with the indigent care and patients that can't pay?
Well, part of it is internal systems. So we've invested quite a huge amount of money into building a really state-of-the-art electronic medical record and hospital information system. And so we're able to capture a lot of the information that we need to be able to bill, and bill credibly and bill accurately. And so we feel that that's going to facilitate the flow of cash inwards. We're also very concerned, obviously, about the uninsured populations. And we're working with MIP, and we've also begin to make some inroads with the other island communities to figure out how we can begin to partner to provide some kind of medical insurance or health insurance program for them, so that when they come to Guam, they will have access to quality health care.
Interesting. Have you made any inroads with the folks up in the CNMI and talked to them about being able to provide some kind of I don't know what's the word I'm looking for, a path of care from the CNMI to Guam?
Absolutely. So there's already a very strong and growing referral path from the Philippines to CNMI, and obviously Guam is a natural connector to that referral path, and the conversations are definitely going and going well.
Yeah.
And we're very excited to be able to serve our neighbors, beyond Guam. We're called Guam Regional Medical City because we do have a regional perspective, and we're looking to the FSM and Palau and the Marshall Islands and CNMI certainly as part of our patient base.
I was thinking about all those poor people that got pushed the wheelchairs around at the airport in the Philippines.
Absolutely.
They're going to be without a job. They won't have anything to do.
They'll be doing better, more productive things.
Can I get you one more phone call, Margaret?
Sure.
All right. Before I know you're probably one of the busiest people on Guam in the next. Are you going to be here permanently between now and the opening, or?
Kind of back and forth, but I'll be here a lot more.
Okay. Well, you're welcome to come into the studio the next time we get closer to another update conversation. We'll take some more phone calls.
I'd love to do that.
Oh, it's a good time. Ray, you're on with CEO Margaret Bengzon from Guam Regional Medical City.
Ray, hafadain mabuhay.
Hey, pare, kumusta ka?
Mabuti naman.
Mabuti.
So the reason for this call is just to bring some awareness and concern. I'm in the Philippines every month, and I like to do things in a positive way. But, Margaret mentioned quality health care, and I've been trying to meet with her since December, and it's in February now. And we had a Guam resident who had a problem in the Philippines, and I just happened to be involved because I'm there. I want to resolve this issue. And so, sometimes you know what you know, and you say things are going to be better and things like that. But I also want to applaud that GMH has been doing a terrific job for us. And sometimes you don't know until you see something different. I'm not happy with my experience because I'm trying to resolve an issue for a Guam resident who went to the Philippines for health care, and no one is doing anything about it. So I'm concerned.
Margaret, I can give you Ray's contact information, and if you get some free time, I'd love to be able to facilitate a greet.
Sure, absolutely. It's very important that these issues get resolved.
Ray, that's the best I'm going to be able to do for right now. I got to let you run.
Thanks, Ray.
I got a bigger name on line 4. If you don't mind, the Speaker of the Legislature, Judy Wanpat, wants to join the conversation. Good morning, Speaker Wanpat. You're on with CEO Margaret Bengzon.
Good morning and welcome back, Margaret. Good to.
Thank you. Hi, Judy.
What she was talking about is something that we've started a conversation already a couple of years now.
Yes.
Which is to have regional insurance for all of the other islands. And we wrote a grant to OIA to get some money to see if we can do an actuarial study. So I've asked the Congresswoman, of course, and the Governor who's in D.C. right now to follow up on that. And to also say that our insurance companies here actually all have a presence in the islands and are very interested in this. So Margaret definitely is on the right track to try to get everybody. We're trying to get everybody insured so that when they go between islands, come to Guam as well, that they should all be covered. So that's all of the FSM states to include RMI, especially because of what has happened in Hawaii. Now, Palau has their own, but they're going to wait and see whether this is going to be a better offer for them versus what they currently offer their own people. Lastly, I've been in communication with the legislature in CNMI, and last year we had our first inaugural MILAT meeting between the Mariana Island Legislatures Association. And this year, CNMI is supposed to host it, and the main topic that we want to talk about is MIT between Guam and CNMI and Medicaid. So hopefully we would have more news, and especially from Washington, D.C. So I just wanted to contribute to this conversation this morning.
Super.
Speaker Juan Pat, thank you very much. I'm just delighted that I've got a couple of power women on the phone, and I'm reminded of that button you like to wear, the well-behaved women seldom make history.
Yes, I do have that button as well.
So I wanted to point that out here as we move this conversation along. Speaker, again, thanks very much for your time. We'll talk to you again and hear you in the weekly address. Margaret, I appreciate you being able to spend so much time with me this morning on the program, and looking forward to having you in the studio one of these days. And maybe I don't know if it's too early to make the offer. I'd love to do a live broadcast from your hospital, perhaps when it opens up.
Oh, absolutely, absolutely. So I'm accessible, so you know how to find me, so anytime.
I sure do. Thank you so much for your time again. Margaret Bengzon, the CEO of Guam Regional Medical City with us.